Great, thanks everyone. Can I have it on this one as well too, please? Thanks. I'm Stephen O'Connell. I'm an assistant professor at Emory University. I'm glad to get to present some work with a couple of co-authors who are here with us. Owner you heard from in the last session. He's at Bentley University, as well as Matilda, our partner at UNHCR Lebanon, and her colleagues Amy and Paula, as well as I2 and Zeynep, who are graduate students at Harvard Kennedy School and Northeastern University, respectively. They are both political scientists, comparativists, and they will be on the job market later this year. I can tell you that they are great colleagues. They would be great colleagues for you too. So I'll talk to you today about something we've been working on for a while, since about 2018, on the targeting of humanitarian aid programs and whether we can do this using existing data sets. So, this one? Okay, great. I won't give too much introduction to the background to the Syrian refugee situation in Lebanon. Everyone is pretty familiar with that at this point. We know that there are more than 1 million refugees currently there, and at this point, Lebanon has the highest refugee to population ratio. The primary mode of basic needs assistance to refugees is carried out through unconditional cash transfers, which are jointly administered by the UNHCR, WFP, as well as other partners. And they target these unconditional cash transfers with the intent of prioritizing the most socioeconomically vulnerable among the refugee population. The challenge in doing this, which is a challenge in any context in which there's program targeting, is allocating aid to the most vulnerable, and in particular here in a context of chronic underfunding, capacity constraints, and limited information on socioeconomic status. So, sorry you can't see this too well, but we know that in Lebanon, refugees are living throughout the country. There are different levels of concentration in different regions. They're not clustered in camps, and again, somewhere north of 1 million in the country these days. The two programs that we'll talk about targeting that we've been working on consist of an unconditional cash program, which you heard a little bit about yesterday, which is a $175 a month transfer per household. And again, as we'll become familiar with, this is something that's allocated from the bottom up with the intent of prioritizing the very poorest. There are also restricted and unrestricted food vouchers, which in name they're food vouchers, but these are also essentially cash transfers, and these scale with household size. It's a monthly transfer of $27 per member, and again, allocated in principle from the very poorest up. So eligibility for these programs is intended to be for households who spend less than $87 per person per month. Now, sometimes program constraints don't allow that entire population to be served, but this is essentially the population that is to be targeted. Those that are below what's known as the survival minimum expenditure basket, which is a consumption level determined by the government of Lebanon. And in 2018, about 55% of households were below that minimum expenditure basket. Okay? So these programs are intended to reach this 55%, and there are annual program cycles that operate from October to September. So the traditional approach to targeting anti-poverty programs of this nature are proxy means tests, in which there's typically a representative survey of a potentially eligible population, living standards type survey, in which demographics and verifiable assets are used to predict socioeconomic status, and a set of predictors is taken from these surveys and then essentially applied to the entire population to score the very poorest up to less poor and richer households in order to target these programs. The things that come out of these surveys very often and are used for the targeting components are things like family size and structure, demographic structure, as well as verifiable assets. Do you own a TV? Do you have a mobile phone, a refrigerator, stove? These kind of things that can be observed by enumerators when they go and do household visits. Okay? Then these data are essentially combined, and households are scored according to coefficients from the model once that information is collected in a survey from the entire potentially eligible population. Now, as we're thinking about this in the context of Lebanon and the entire potentially eligible population being quite sizable. Okay? Now, this approach, something quite like it, was used to target unconditional cash transfers in Lebanon in 2014-15 and 2015-16. But there are particular challenges of doing this kind of proxy means test in the context of refugees. It's a relatively homogeneous population. It's quite poor to begin with. It's been made even more homogeneous because most assets have been left in the home country. It's mobile internally and externally, so targeting needs to be done on an annual basis. It was found out that it was quite difficult to reach the entire population in these targeting surveys. When this was done in those years, more than 30% of households were not able to be reached. This might end up implicitly preferencing urban areas or more stable households. And when a household isn't reached, to collect these indicators that you get out of the survey to rank them with everyone else, they're just immediately not able to be included or considered for the program. So there are some drawbacks to this. In 2015-16, this survey-based PMT was ended and replaced by alternative targeting methods. And just for disclosure, the first couple rounds of this were joint between UNHCR, WFP, and a team at AUB. Our team has been working on this since about 2018, the last couple rounds of targeting. So the real question about this paper is whether we can use administrative, or what I'll put in quotes here, registration data that many people are familiar with. These are records that are routinely collected by the UNHCR in order to target these unconditional cash transfer programs. Can we move away from the survey-based model and use existing data for a new purpose? And if we do that, how well can that be done? What are the costs and other considerations to take into account? Now, why this is a bad idea is that this database is collected and maintained for completely different purposes. It's not designed for assistance targeting whatsoever. And there's really no reason to expect ex ante that registration data will be good at targeting socioeconomic vulnerability. Okay? Second question, we will actually take on how this targeting approach and its accuracy compares to the traditional survey-based proxy means test, even under an assumption that you could reach 100% of the households. And if there are any differences between these two in terms of targeting accuracy, how could they be explained? Okay. So the data is going to rely on two sets. The data to do this are going to rely on two different sources. One is a National Representative Household Survey, which is being conducted annually to understand and communicate the situation of refugees in the country. About 4,500 households are surveyed every year. And really all we're going to take from that survey, which is going on anyway, is the expenditure data for these households. Now, this survey also includes full household and individual modules, covers demographics, work and income, debt, as well as assets. But for what we're going to do, we're only going to take expenditures out of there. This is going to be matched to the registration or the enrollment records that UNHCR keeps and maintains for for its core operational objectives in the country. So we know that these records have basic demographics and background, age structure, demographic structure of the household, some information about medical and health situations, some protection flags, things like single woman, working child. And these records are updated by in-person interviews, either on an annual or biannual basis, or when refugees' situations change. Okay? We can also add into this part of this administrative data. We know who is currently receiving either of these programs, as well as other smaller assistance programs. Very quickly, I'll show some summary statistics of these. We know that the refugee population is relatively young. About half in these records are female, relatively uneducated, high proportion who had either no listed profession or were housekeepers, very few individuals who report having worked in service occupations before. And at the household level, on average, households are between 4 and 5 individuals. Household head, on average, mid-30s. And we see that demographic structure heavily tilted toward younger populations. The average share of dependents in households across the country is around 50%, which is not particularly due to the elderly. Okay? And again, I'm happy to take questions as we go through this. We should have plenty of time. So we take what we can out of the registration data and construct a set of potential predictors that will be fed into the modeling process. This ends up being aspects of household size, structure, what we have on education, what we have on prior occupation, year of arrival, whatever protection measures are in the data set, and geographic indicators. Okay? Around about 50 to 60 variables that might be considered in determining this targeting model. When you think about what we're trying to do, this graphic generally encapsulates the idea and the challenge. What I'm plotting here is the distribution of expenditure per capita across households in Lebanon. Let me just do this and then we'll... And the blue line is the $87 per person per month. So the challenge in targeting for these programs is to correctly predict the people who are over here to be less than $87 per month. Yeah, question?
Sorry if I misunderstood. I was not understanding why you wouldn't use all the variables and let the machine tell you which
That's
ones.
what we're going to do.
Oh, okay.
Yeah, we do. Yeah, we use all the variables from this limited set that's in the registration.
Why? Oh, so those are all the variables that you have, or not?
Those are all the variables in the registration data.
I thought you were selecting.
Yeah, we're going to take all of them and slim them down and then see how it does.
Sorry.
Yeah, no problem. So to do this administrative data approach, we can only use fields that are in the UNHCR database because we need to be able to develop a model that then can be extrapolated and predicted into the full population from which you then target. Okay? So again, these are just demographics, location, some background. And some things to think about here is that this approach is going to have potentially a slightly lower concern regarding endogenous underreporting of scoring variables, which people at this conference have worked on before and shown that when proxy means tests are carried out, that if in 1 year you ask about TVs, next year a whole lot more people are reporting that they have TVs. These kinds of things can happen. There's a relatively involved process to change your household composition in these administrative records, so we're not too worried that people are pulling individuals into the household in order to game this modeling.
Yeah,
and
this is not a household, it's a case.
It's a case.
Yeah, so.
Sure. All active cases are going to be scored, and in expectation, these cases are being updated every 1 to 2 years, and non-active cases are being removed from the data. So part of the challenge here is that we also want to generate a unique ranking in an out-of-sample prediction. So we need to preserve, the way I set up the problem a minute ago is I said we need to predict everyone to the left of the line correctly. For operational purposes, we actually want to maintain a unique ranking, okay? And this is, again, an out-of-sample prediction exercise. So to do this, we're going to use cross-validated estimators that protect against overfitting. Yep.
I just have one question, since you're looking at the cases, right, that you have in the progress database. To what extent are you sure that all of the cases live in the same household, or that a household is only made up of one case? I remember when we looked at the VASIR database, sometimes in one household there's more than one case, or perhaps not the entire case lives in one household. I mean, I'm not sure how you would handle this, but I mean, perhaps our UNHCR colleagues have a better idea of this, but I was just wondering.
Yeah, that certainly does happen, that they live in the same household. From the UNHCR database, from the VASIR data, we'll know how many people those are living there, even if they're from multiple cases. And so all we're getting out of that from those data are the expenditure per capita for the people living in that household. So that generally applies if you're in 2 different cases.
Okay. Okay, and I have one more question. When we were using the progress database, there were a lot of concerns raised about the occupation variable when we were talking with UNHCR, since they said it could also be occupation back home in Syria. They weren't sure how much of it is really updated. I don't know if our UNHCR colleagues now have new information, but I was just wondering, because I saw you were using it, right, for the housekeeper or not? Or you're just using that as noise and just use it as a predictor?
Yeah, I mean, we're just using it as a predictor. It may be current occupation, it may be occupation prior. The way they asked that question might have changed, but if it doesn't give us any information about predicting household expenditure per capita, it'll be tossed out of this anyway, because we're not going to force there to be coefficients in these models, because we're going to have regularized linear regression, which is going to choose which features remain in the model. Okay, so the details of the econometric procedure here, we're going to be estimating log per capita expenditure with that full set of variables that we have from the registration data. And we're going to use, our primary approach is to use a lasso regression, which is really going to solve a minimization problem subject to a constraint on the total number of coefficients, or rather the total aggregate size of the coefficients in the model. Okay? What this does is, again, essentially protect against overfitting. Now, in the last slide, I had a little note on this, that we have 4,500 observations. We're only using about 60 variables. We don't necessarily worry about too much about overfitting, although lots of those variables are highly multicollinear, so this is the right tool to be using for the situation. Okay? Lambda, the hyperparameter, is going to be chosen by cross-validation, so we're essentially going to be using holdout samples to ensure that we choose a penalty parameter that will work for out-of-sample prediction. Conceptual mapping of the databases that we use, I'll just go through this quickly. We have the VASIR data from which we extract the expenditure per capita, and for that sample, we match that with the UNHCR database and the assistance records, etc. That gives us a vector of coefficients. However strongly we want to penalize them. I'm not even going to present to you any of these coefficients, because we don't really care about what they are, in service of knowing what is our prediction accuracy. Okay, so once we have those coefficients, we can predict back into the full population for the targeting purpose, as well as for our paper to be able to know how this model is performing. Okay. So a quick check, what we do present to see that the model is actually capturing things that we would expect, is to look at what are the characteristics of different cases at percentiles of predicted expenditure. So you can look at, the 10th percentile, larger households, more likely to be female-headed, more likely to be having low education levels. People at the 90th percentile, small household size, much more likely to have higher education. So even though we're not going to be requiring all of these variables to be in the model explicitly, we're capturing profiles that we think would be poorer versus not. In general, our overall rate of severe vulnerability, which is that $87 per capita figure, is about 55 to 56%, which is actually matching the aggregate figure in the country. It's relatively consistent across different regions of Lebanon, so we have that sort of check that we're just capturing things in aggregate in a way that makes sense. Okay. So we're going to compare this approach to the accuracy of a model built in the, let's say, the traditional way, if we were to take the same household survey that we have, select down from a much wider set of variables, and assume that we could go out and collect those variables from the however many 100,000 households are in Lebanon, okay? We're going to use the same cross-validated penalized regression model with demographics, geographics, as well as the set of asset variables that are in there. And again, as I said, this is going to assume that this survey deployment would reach 100% of the households. So really, what this paper is about is asking what's the value of household visits in terms of targeting accuracy for large-scale humanitarian UCT programs. Okay? So we're going to have 3 metrics of this. What I'll present are just the first 2. In the paper, we have a different one, but you all may be familiar with metrics of inclusion and exclusion error. Inclusion error asks, of those whom we're predicting to be below 87, who will be in the program, who are, of those who are predicted to be in the program, who are not being correctly predicted, they are actually richer than we think we have them. Among those who should be included in the program, what share have been wrongly excluded? That's exclusion error. And I'll just say that on the next slide is going to be the main results of the paper, which are really just comparisons of inclusion and exclusion error between these 2 approaches. Okay? So getting at what is the value of household visits in terms of targeting accuracy. And what we have here is the administrative data approach to the left, inclusion and exclusion error, and the survey-based approach to the right, inclusion and exclusion error. So we're going to compare the red series, 31% inclusion error in the administrative data approach, to 29% in the survey-based approach. So assuming that you could go collect any asset data that you want, you would only be reducing inclusion error by about 2 percentage points, and these differences are not statistically significant between those 2. Exclusion error is slightly lower to begin with in the administrative data and only reduces by about 3%, again, even if you had that flexibility to go to 100% of households and collect assets. Okay? We had a reasonable referee, thanks for that, suggests that we should check this approach against a whole bunch of other methods and choices. We've checked it against, that lasso model is one particular implementation and one way to penalize the coefficients, elastic nets or ridge regressions, again, comparing to the survey-based approach, those don't really make much difference. There are clear advantages over using forward selection models, or of course, as you might expect, overfit OLS or random forest models. So in general, penalized regression is only a few percentage points higher than undertaking the survey-based approach and not statistically different from each other. So then we were asked, well, if we could add 1 or 2 variables to the registration data to then reduce those targeting errors to the level at which you could get from the survey data, what would those be? So we can start with our administrative database model and essentially pull one by one the survey variables in to see whether a small number of these could actually achieve those reductions if we had the scope. Now, we don't know whether that's possible, but at least we can answer the question in principle to see if there were a scope to collect different things at registration, what would those be in service of targeting? Okay? So again, you can't see too much, but really there's a couple things here. To the left of the graph is a reduction in targeting error. That's good. There's a couple variables that reduce targeting error by a couple percentage points. The biggest one that stands out is information on the type of housing that refugees are in. This is something that, one, is not necessarily related to the demographics or the simple information that we already have in the registration data. 2, makes up a large share of expenditure typically. And 3 has a lot of variability in the population. There are households living in tents, there are households living in very poor structures or no structures at all, as well as some residing in apartments and things like that. So could housing type be added to the registration data? The couple percentage points difference in targeting error would be substantially reduced. Other additions could be whether they have beds or has a refrigerator, but those are probably harder to know from a registration perspective. All the rest have really trivial effects on reductions in targeting error. We also performed a blind out-of-sample validation where after we developed this model, we went to an additional 500 households that were not captured in that vizier that we used to train the model. This is a bit of overkill because we were doing cross-validation anyway, and we didn't. But there was secondary objectives that were wrapped in with this, and basically we can show that in the training data, the error rates, as we would expect, are very comparable to an extra sample, in fact, collected several months later and several months closer to the program implementation. So to some degree, this speaks to whether these are intertemporally reliable. And yes, we generally conclude that that's fine. Then we really wanted to compare the targeting accuracy of these programs to accuracy of programs around the world, to the degree to which we know about these. So I didn't discuss this metric that we're using, but there was a review paper in 2004, which seems like forever ago, and if anyone knows of any newer reviews in this literature, it'd be great to know, where they took close to 100 targeted programs run by governments around the world, came up with a metric that could make them comparable across each other, and then essentially did a meta-analysis of targeting accuracy across these programs. What we're plotting here, each position on the x-axis is a different program, obviously lined up in a particular way. And there are all these programs. The median is the dashed line. Sorry if you can't see it. And then we're plotting against different variants of this modeling that we've done for Lebanon, where those fit in the distribution of targeted programs around the world 15 years ago. Okay. In general, this is roughly in the middle, just above the median, so it's not too far below what the average program is doing. So this is really the first paper that I've worked on, which is essentially a null results paper, in a sense. There's not a huge difference between these two approaches, and we're finding that humanitarian agencies can target an at-scale unconditional cash or in-kind transfer program to refugees using existing data without surveying the entire population and without a major loss in targeting performance. We can then point directly to a small number of variables that could, in principle, be added to the registration data to improve even further, although that improvement is relatively small. And we validated it. There's lots of detail in the paper about this blind out-of-sample test. Now, in terms of practical implications, for this program, the cost savings of not going and surveying every household is around 3 to 4% of the program budget. Okay? So if this is recycled and reallocated into the program, it essentially pays for itself in terms of that additional exclusion error. Right? Exclusion error is about 3 percentage points higher. And so there's significant cost savings to this. Now, some final thoughts just to end on the right note is that do we think we have solved poverty targeting? No. Targeting 50% of the population is relatively easy as far as programs go. Some programs only can target 5% or 10%. We know that targeting error is going to mechanically increase as the share of those targeted goes down. But we show, and we'll show in the paper, that this moves in parallel across the different approaches. So even if you're trying to target the poorest 10%, you can still use administrative data to do it. We're targeting 50%, and it's still in the same neighborhood. Relative cost savings are going to increase with the ratio of survey costs to the aid package. The aid package under the cash program to these refugee families is about $2,100 a year. That's relatively large for unconditional cash transfer programs around the world. So the degree to which survey costs are roughly the same around the world, I mean, yes and no, they're not, but smaller programs, the cost savings from not going out to survey every household is going to be larger relative to the size of the aid package. And so we're working now on understanding heterogeneity and targeting accuracy across subpopulations and what considerations in terms of modeling can be built in. So that's it.
Thank you.
Thanks very much.
Thank you very much. I start with a question. So we have two papers that did exactly the same thing, one in Jordan and one in Chad. And one of the problems that we found with the proxy-means test is really the linear predictions, which is very poor on the tails, and therefore you really need to work on the error term. Now, with the classification method you use, that's a completely different approach. But so I have a follow-up paper what I do is actually comparing the linear OLS model with the logit model with the lasso model, random forest, to see whether you can gain in terms of exclusion and inclusion errors. And you do gain in certain cases. But what it comes out is actually that what really matters is the poverty line. So as you move the poverty line along the distribution, what happens is that certain models become better at predicting poverty or consumption. And so I wonder whether one, you've thought about the tails and the error terms in those terms, and two, whether you've looked at the sensitivity of this exercise moving the poverty line.
Yes, we have. I didn't have it ready to show today, but essentially you can think of what's the inclusion and exclusion error rate essentially on this last point, right? If I target at 50%, or if I'm targeting further in the tails, right? Does one actually surpass the other when you're only targeting 5 or 10% in a substantial way? The answer is no. I don't have it in a graph to show you, but the lines move very much in parallel.
So in the current validation exercise, you needed a household survey to calibrate the registration data with the model. Can in the future UNHCR operation, can we do without a household survey? Because we will have the registration data and we can apply your findings. So the key variables that you took from the registration data, can we do without a household survey, you think, for the targeting?
So the validation survey that we did was not essential to developing the model nor assessing its accuracy rates. It was an additional check, and we actually did this the first year, and it wasn't necessary after that. So I don't know if that's quite what you were asking, but this validation survey, as I was saying, is actually overkill because we know that the cross-validated error rates should be good out of sample, which is essentially what these three are showing compared to those three.
So the registration data suffice, actually?
Yeah, I would say in this context, I was trying to put a little bit of bounds around this. When you're targeting at about 50%, and you have programs of this nature and scale where the cost savings make sense, then that's what it seems like here.
Yeah, and part of the reason is because the explanatory power of the main variables is very, very large. So you got household size and you have most of the explanatory variable there, and then it gets very, very small as you get down the list. And in fact, if you have 6, 7 variables, that's enough. And those 6, 7 variables actually are already in the registration system. So, I mean, one recommendation is what other variables the registration system could include that would really increase the explanatory power of that model. And that would be something that the UNHCR could use.
Yeah, that's what this was doing, at least from the set that are in the survey data that we could sort of test out. That's exactly what we're trying to answer with that. Yeah. I had some there.
Can I go to measurement and Stephanie's question for a second? Because you still have kind of the training on one in the one data set, but you need it to be measured similarly in the progress in the registration database at the same time, right? So if they're not collecting it in the same way, that they were collecting in kind of the training data, that's still going to be measurement in that registration data is still going to be important across surveys, right?
You would be right if I were using the same variables from the household survey in the training step. We actually bring that vector of registration variables and merge it only onto a single column from the household data. And then that's used to predict back into the population. So we're using the same variables in the training data set on the right-hand side as are used in the prediction for the entire population. Does that answer?
We can talk about it afterwards.
Okay.
Okay, so I agree with what Paolo was saying. What's useful for us is to know what else we would have to put back into our progress database. But I'm thinking about something, and I couldn't see because it was so small, what were the other variables you were using. But for example, one of the things that we don't always have in progress is what kind of assistance programs refugees are getting, which also I think impacts where somebody sits along that line, right? So say, for example, someone, an NGO is providing agricultural support, or they're doing a livelihoods program for those particular families, which would change, in my view, where they sit. Just because there's a lot of smart people in the room, I also want to say that it's not just targeting for cash. Right now, the World Bank, under the IDA 18 refugee sub-window, we have a lot of programs looking at social protection, and we're being asked who should go into these social protection programs. So in the Republic of Congo, we're being asked, who do we target to go into these programs? So it's really important that this discussion on targeting really help us, because we don't have answers. And it's becoming more and more important for us to be able to do this. And like you say, if it's equally valid at much less cost, then that's what we should be looking at. But this is a really, just so everyone in the room knows, this is a really important conversation for us right now around targeting, but not just for cash, for other programs as well.
Thanks.
And
or more information. I mean, first of all, thanks very much. It's like Betsy said, very, very timely and very relevant. We're getting requests for targeting, all the time, and don't have, a lot of evidence to point to inform decision making. And the way that you frame, the question about adding variables also is relevant, because that's something we can change. And if we can take evidence into that discussion, that's also helpful. But this, it's not quite enough in this case, because we also operate in very diverse settings, and the explanatory variables in some cases aren't going to apply to others. So it's also a call. I think we need more work like this to strengthen this argument. It's a great start. We have the potential to add variables to progress, and create tools to do this. But I think we do need to build on this. And then just two pieces of information too. You raised the question about the occupation codes. I think this was Stephanie. It's problematic. It's something we've been working on, and we're looking to make some changes to that to better suit work like this. And in fact, our colleague Felix back here, this is something he's been looking at in quite some detail. He'll be part of the team here at the Joint Data Center. Similarly, the issue around the household definition and the case definition that Paulo raised. This is, on the surface, it doesn't seem like much, but it's actually quite tricky when you start to match the administrative records against household surveys. Also, when you look to compare some of the indicators to national populations, which is, of course, not the first thing you think about in terms of targeting, but in terms of the broader policy context, it's absolutely critical to have that comparability with national surveys and national populations. But it's a challenge you should be aware of, at the onset, and it's also something that we're looking into and trying to both provide the background material to help your research, and then also to support changes in the way that the data is collected to try to resolve these issues too. So, two pieces of information.
Yeah, thanks for that. I agree, but I also agree with what Paulo said, which is that the changes in terms of adding variables are going to be very marginal after the first 6 or 10 things you find as the strongest predictors. But yeah.
But if we can, have evidence about what those 6 or 10 variables are,
Sure.
then that allows us. And we have the space in, for example, in Progress. You're familiar with the core registration variables, but there's already add-on optional modules for a socioeconomic entity. It's currently populated with just kind of a generic set of indices, but we're trying to use evidence like this to actually inform a more thoughtful approach to what that module looks like. And we have, it's kind of in the plans for the year to come too, is actually to change what that looks like in the registration system. But we don't want to do it in an ad hoc way. We want to, because it was done initially in sort of an ad hoc way. So we want to have that conversation about what should go into it, what can go into it.
Thanks. Tuan?
Yeah, so just to follow up on Jet's point, I think here we need the survey and we need the registration data to train the model. And I think on the savings part is not if a variable is significant or not to predict, is when it is the case. Because ideally you want to go in a place and just do registration and know what variable to choose and not do a whole list of variables, launch an expensive survey and then train the model and then, so is there, do we have enough data, enough experience to be able to know which variables are good predictors and in which circumstances they are or they are not? Do you have an intuition on that?
I mean, whatever we have here is going to be probably specific to the refugee situation, a very large scale one with a very highly homogeneous population. So, I mean, can you extrapolate that to a non-refugee situation? I don't know, but I mean, we're happy to share what we found, and there's going to be a list of things that will just always be collected anyway. That's sort of what we're saying gets us most of the way there, because what's already being collected anyway is what's in the registration, and that really gets close. So, I mean, I don't have a final answer as to what we can,
But we do to a certain extent. I mean, we have done that on Lebanon and Jordan and compared the results, and the variables, the prediction capacity of variables is very, very similar. Of course, the Syrian refugees in 2 neighboring countries, but the 2 countries are different. And also when we did it on Chad, the list of variables and the order of variables is also very similar. And so, we're fairly confident that these models can be extended to other types of populations. Of course, every time it needs to be retested, so you need consumption data to recalibrate the model at the country level, but otherwise can be done.
I just want to add one piece of information, is that I think because as most of the assets are left in the home country, the assets that they can carry is human capital. So we expected, actually, we thought that the household size, for example, is a big predictor. But actually, it's not the household size that's driving this prediction result. It's really education, it's occupation, and sort of like the skills that people can carry from Syria to Lebanon that you can measure. And maybe there might be other, you can measure, you can increase the quality of measurement of these things, especially human capital, that could increase the prediction power of this model, I think, in a way.
Yeah.
In other words, you don't really look for.
I mean, the household size is really has its own meaning, separately from education or occupation or the other. In this model, I don't know in Turkey, but certainly in these other countries, and there is very little collinearity between these variables. So.
Let me just add one specific response to Tuan's point, actually. So we have this result that adding type of housing is going to at least get us a bit closer to the survey-based approach, right? That is not going to do anything in a country or situation in which everyone's living in camps and standardized type of structures, for example, right? So we consider all of this particular to the situation, but you can think of contextual factors that will either make those more important or less, for sure. Okay.
Especially after people have been there. Especially after people have been in these places for a while, you see big differences, especially in roofing, which is a good indication around poverty. So I don't agree on that point.
Okay.
Any other questions? We are over time. Last question.
Just following up on this overall conversation, to what extent you can extrapolate from what you have. I guess that to pick variables that don't vary too much over time, because we heard before that the Lebanese, they kind of move housing like 10 times in a year, or like, no, I'm exaggerating now, but I think that's what we heard. But then again, progress is only updated, like in this case, every half year. So then you might, I mean, of course you still capture something, but if there's a lot of fluidity in the variables you have, then you need to do the training very soon again. And I guess in your interest, you at least want to use it like for 2-3 years in a row, and then I guess update. So, but I guess if you use a survey that is being conducted anyway, like the Wazir, which is done every year, then of course there's synergies, and then once you have your model, you just put in the new data and it spits it out. I guess that's when you have synergies, if, since the UN collects the data anyway. And I presume that's similar in other contexts.
Yeah, but also, I mean, I remember the first time we used the home visits data, they were interviewing 5 households per month at the UNHCR, right? So we can still collect consumption data, good consumption data frequently, not necessarily 5,000 households per month. Maybe we can do it every year, and that would be more than we do on poverty. Thank you very much.
Great. Thanks,
you.
everyone.